This morning, Andrew Price with Hometown Medicare Advisors is here to help us all become more Medicare educated. And today, Andrew is ready to discuss a term we hear a lot. It's all about Medicare supplements. Good morning, Andrew. How are you?
I'm doing great.
What are Medicare supplements?
So Medicare supplements supplement Medicare. Medicare doesn't cover everything. Medicare usually doesn't cover the 20%, and so Medicare supplements fills that gap.
Now, we hear a couple of terms. We hear supplements and we hear Medigap as well. What's the differences there?
So there's a lot of terms with Medicare. A Medicare supplement is a Medigap. So if you ever hear those terms, they're interchangeable.
So we hear, we hear a lot of terms. There's so many different supplements out there to choose from, aren't there?
Yes. So to make it more confusing, you have Medicare Part A, B, C, and D, and then with the supplements, you have Plan A, B, C, D, F, G, K, L, M, and N.
Wow. And we showed that graphic up there real quick, but that's a mouthful. There's a lot to contend with there.
There is. We can say I have a lot of job security helping people figure all this out. Yeah. To make it simple, I usually deal with the Plan G.
And we hear all the time about doctors not taking certain companies' insurance. Is that true about Medicare supplements as well?
No, it's not. So Medicare supplements, as long as a doctor takes Medicare, they have to take a Medicare supplement. There's no networks, so as long as a doctor takes Medicare, you can go to any doctor, any hospital in the country.
And if we could put that graphic back up we were just looking at, so there's all these plans. What are the differences in the plans?
So the differences in the plans is they cover the 20% a little bit differently. Some of them don't cover all the 20%. Like I said, the plan that I like the best and is the most popular is the Plan G. The Plan G covers all the 20% except what's called the Part B deductible. The Part B deductible is $203. So if you pay the first $203, you don't pay anything after that.
And what about copays? Are there copays?
With the Plan G, there's not. Once you pay that $203, you don't pay anything for the year.
And if you're at the hospital, how much do you pay at the hospital? Let's say you're in the hospital for a week.
So with the Plan G, you don't pay anything at the hospital. After you pay that first $203 deductible for the year, that's it.
So if it covers everything but the $200, except the $203, it must be expensive insurance.
Yes and no.
Yeah.
So supplements are the most expensive Medicare plans, but Medicare plans are designed for people on a fixed income, and so they're relatively affordable. They usually, a Plan G will start around $100 to $150 a month. If you compare that to health insurance before Medicare, there's a lot of people paying $800 to $1,000 for a high deductible plan.
And, we were talking about off camera just a little while ago, you've got a busy time of the year coming up. It's annual enrollment time. Can they change their plans when it comes annual enrollment period?
So the good thing about Medicare supplements is there's not a enrollment time. So you can actually change your Medicare supplement at any time. So if your supplements go up in price every year as you get older, and so if you want to shop around, you can actually do that right now. I was actually helping a guy that was about 72. He was paying around $250 for his Medicare supplement. We were able to get him the exact same Medicare supplement for about $70 cheaper.
And you've got folks probably right now have got a lot of questions out there, and you've got some seminars coming up. Tell us about those.
I do. So we did some in July, and they were a big hit. So we're doing them again in August. We have one in Kingsport, one in Bristol, both at the libraries, and then we have one in Jonesboro at the Visitor Center.
And if you look, you got these Medicare education seminars coming up, and I'm sure people see commercials and things on TV all the time about supplements and Medigaps and things of that nature. This is a great opportunity for them to get their questions answered right there in person.
Yes, I love doing the seminars because we get face to face and we get to talk and people get to answer questions without being on the phone or without feeling that you're being sold something.
Right. Bottom line, when folks come to you and say, do I need a Medicare supplement, or it's an individual by individual case, isn't it?
Yeah, so Medicare supplements are what I call the Cadillac plans. The people that don't want to worry about anything, they usually go with a Medicare Supplement. Now, Medicare Advantage plans are very different. They're a good fit for a lot of people, and a lot of people go that route. It just depends on what your situation is.
All right. Andrew, thank you so much. We covered a lot of ground there, but I think it's good ground to cover because a lot of folks have questions, and you can get those questions answered right here at those education seminars that we have up on the screen right now.
The preceding portion of Daytime Tri-Cities was sponsored by